Ever wondered why heart disease is considered the silent killer? This is due to its ability to strike without warning, making it a major global health concern. Heart disease, in its many forms, is responsible for a significant number of deaths every year, affecting individuals across all walks of life. It's a broad term that encompasses a variety of conditions affecting the heart, including coronary artery disease, heart failure, and arrhythmias. In today's fast-paced society, understanding heart disease is more important than ever. This isn't just about knowing what it is, but also recognizing its symptoms, exploring available treatments, and learning about preventive measures. This knowledge could literally be the difference between life and death. It's time to shed light on this silent killer, to demystify it, and to equip ourselves with the tools to fight back. So, are you ready to learn? Let's dive into the world of heart disease, starting with its telltale signs. Kicking off our countdown at number 5, unusual fatigue. Now, we all experience tiredness from time to time due to our busy lifestyles. But when we talk about unusual or extreme fatigue, we're referring to a persistent state of weariness that doesn't go away with rest. This could be a warning sign of heart disease, particularly in women. It's because your heart is working harder than it should to pump blood. That's right, your heart is like a powerhouse, and when it's under stress, it can leave you feeling drained and unusually tired. This kind of fatigue is more than just feeling sleepy. It's an overwhelming sense of exhaustion that can come on suddenly. So if you find yourself feeling unusually fatigued, particularly after activities that you used to handle with ease, take note. Fatigue might be common, but when it's unusual or extreme, it might be time to consult a doctor. Moving on to number 4 in our countdown, shortness of breath. This symptom is often overlooked because it's so common. We all get winded from time to time, right? But when you find yourself gasping for air during normal, everyday activities, it could signal something more serious. This shortness of breath, also known as dyspnea, could be an indication of heart disease. Here's why. Your heart and lungs work together to supply your body with the oxygen it needs. If your heart can't pump blood as effectively as it should, your lungs may not get enough oxygenated blood. This makes you feel winded even when you're not exerting yourself. It's important to remember that everyone's body reacts differently. Not everyone with heart disease will experience this symptom. But if you notice a sudden change, or if your breathlessness persists, it's a good idea to seek medical advice. If you're out of breath doing everyday tasks, it might be more than just a lack of fitness. Now at number 3, chest discomfort. It's a symptom that's often associated with heart disease, but what exactly does it entail? Well, chest discomfort related to heart disease isn't always a sharp, stabbing pain. It can be a feeling of pressure, squeezing, or fullness in the center of your chest. It's like an elephant sitting on your chest, a sensation that's hard to ignore. This discomfort may last more than a few minutes, or it could come and go. It's not always triggered by physical exertion either. You might be just sitting down, enjoying a cup of coffee, when the discomfort strikes. What's important to remember is that chest discomfort can be a signal that your heart is not getting enough oxygen. It's your body's way of sounding the alarm, alerting you that something isn't quite right. Chest discomfort is a common symptom, but it's also one you should never ignore. So listen to your body. It knows when something's up. At number 2 in our countdown, palpitations. Palpitations are those unexpected, uninvited guests that make your heart dance to a beat of its own. They can feel like your heart is fluttering, pounding, or racing, and they often catch you off guard. But what's the link to heart disease, you might ask? Well, palpitations can be a symptom of heart disease. When your heart isn't functioning properly, it can cause an irregular heartbeat, which manifests as palpitations. Sometimes, it's as if your heart is trying to send you an SOS message, alerting you that something isn't quite right. However, it's important to remember that not all palpitations signal heart disease. They can also be caused by stress, caffeine, or even certain medications. It's always a good idea to check in with your doctor if you're experiencing them frequently. Palpitations can be scary, but they might just be your heart telling you something's wrong. And finally, at the top of our list, persistent coughing or wheezing. You may think it's just a common cold, but did you know persistent coughing or wheezing could signal something more serious? It's a symptom often overlooked, yet it can be a strong indicator of heart disease. When your heart isn't pumping efficiently, fluid can build up in the lungs. This accumulation can lead to a nagging cough or wheezing, which can be a persistent, uncomfortable symptom. It's not just about the discomfort, though. This symptom is your body's way of warning you that your heart may be struggling. So if you've found yourself constantly clearing your throat, or if your cough seems to linger longer than the common cold, it might be time to see a healthcare professional. It's always better to be safe than sorry when it comes to your heart health. Persistent coughing or wheezing is more than just a nuisance. It could be a sign your heart needs help. Knowing the symptoms is just the first step. Now let's talk about treatments and prevention. When heart disease is diagnosed, the first course of action often includes lifestyle changes. This could involve adopting a healthier diet, rich in fruits, vegetables, lean proteins, and whole grains. Cutting out processed foods and those high in sodium and saturated fats can significantly improve one's cardiac health. Regular physical activity is also crucial as it helps maintain a healthy weight and keeps the heart strong. Sometimes lifestyle changes aren't enough. In such instances, medication might be necessary. These could be drugs that lower blood pressure or cholesterol levels, prevent blood clots, or reduce inflammation. Each of these targets a specific contributing factor to heart disease, helping manage the condition and prevent further complications. In severe cases, surgery may be needed. This could be a coronary artery bypass grafting, where a healthy artery or vein from the body is connected or grafted to the blocked coronary artery. This allows the grafted artery to bypass the blocked portion, improving blood flow to the heart. There's also angioplasty, where a small balloon is inflated inside a blocked artery to widen it and restore blood flow. Prevention, however, is the cornerstone of tackling heart disease. Regular checkups can help identify risk factors and detect heart disease early on. This, coupled with maintaining a healthy lifestyle, can go a long way in preserving your heart health. Also, it's important to manage stress. Chronic stress can lead to behaviors and factors that increase heart disease risk, such as high blood pressure and cholesterol levels, smoking, physical inactivity, and overeating. Some healthy techniques for stress management include yoga, meditation, and deep breathing exercises. Finally, quitting smoking and limiting alcohol intake can substantially reduce your risk of developing heart disease. Remember, the best treatment is prevention, so take care of your heart before it's too late. So, what have we learned today about the silent killer that is heart disease? Well, we've traveled quite a path, haven't we? We've explored the top 5 symptoms of heart disease, a condition that affects millions of people around the globe. We've learned that these symptoms can vary greatly, from chest discomfort and shortness of breath to fatigue, irregular heartbeat, and swollen extremities. Recognizing these signs early can be a lifesaver, and it's crucial to seek immediate medical attention if you suspect you're experiencing them. We've also delved into the treatments available for heart disease. From lifestyle changes like healthier eating and regular exercise to medications and surgical procedures, there are numerous ways to manage this condition. We've seen that treatment plans are highly individual, depending on a person's overall health, the severity of the disease, and their specific symptoms. Moreover, we've discovered that prevention is a key player in the fight against heart disease. A balanced diet, regular exercise, and abstaining from harmful habits such as smoking can significantly reduce the risk of developing this illness. Regular checkups and health screenings also play a vital role in early detection and prevention. But perhaps the most important takeaway from our journey today is the understanding that heart disease is not a death sentence. It's a condition that can be managed and even prevented with the right knowledge and actions. It's about making conscious decisions every day to prioritize our health and well-being. Now that you're equipped with this knowledge, you've taken the first step towards a healthier heart. Stay tuned for more health-related content, and remember, your health is in your hands.